All new at 6 o'clock. Boxes of cash, a building in disrepair, and a CEO who's accused of taking steps to silence employees. Those are all parts of the latest allegations WBTV has uncovered as part of our ongoing investigation into the C.W. Williams Community Health Center. Tonight, more employees are speaking out.
Sitting down only with WBTV's chief investigative reporter Nick Oxner to blow the whistle on major problems they say aren't just wrong, they're also impacting care for some of the most vulnerable people in our community.
For years, this building on Wilkinson Boulevard was the headquarters of the C.W. Williams Community Health Center, a pillar of a community that many depend on for health and dental care. Today, that building is empty, in disrepair, with plans to replace it stalled.
They needed to be cared for, nurtured, not mistreated in this way.
Dr. Denise Fink-Rothman spent more than 5 years at C.W. Williams. She launched an addiction treatment program.
I wanted to be there. I wanted to help these patients. This was a group of patients that I really wanted to help and care for.
But Fink-Rothman says her job was made more difficult by C.W. Williams management. Things like refusing to renew her Medicaid credentials after they expired, which meant she couldn't write prescriptions for her patients.
I don't understand, why is this going on, that you can't get me Medicaid credentialed? And they informed me that they were also filing my charges under one of the other doctors' names as well.
Instead, records obtained by WBTV show they were billing visits Fink-Rothman's patients had under a different doctor who was credentialed, a violation of federal insurance rules. The doctor says she and the social worker she worked with couldn't access grant funding for their addiction treatment program either.
He was going to start this program using the grant funds. He was told no, he could not use the grant funds.
What I'm hearing you say is that the thing C.W. Williams was doing made it difficult for you to treat the patients.
Yes, absolutely it did. I wasn't getting the help that I needed.
How they started was to be a pillar and to help the community. But where they are now is full of greed.
Sherry Cribb spent 3 months working as the chief financial officer at C.W. Williams in late 2021. She says she left after repeatedly voicing concerns over the center's sloppy financial practices.
I didn't give a notice. I didn't resign. I didn't have a conversation. I said, I'm getting out of here because this place is crazy. C.W. Williams got funding, but it wasn't showing up. It wasn't showing up in the expenses. I wasn't seeing it on the bank statements. So I'm like, where is the funding? What was done with the funding? So then I found out that there was boxes of deposits that had not been deposited into the bank.
How much money are we talking about?
About $200,000 at least. That consisted of the cash deposits that they were getting on a daily basis and insurance checks and the small grants, like when they send those checks over to them, they were also included in this cash that was sitting in a box.
Cribb says she sent a detailed report of her concerns to the board, but never saw any action. This lawsuit, filed last October by a third employee, a doctor and former medical director at C.W. Williams, says she was fired minutes before she was scheduled to present her concerns to the board. The lawsuit says the doctor noticed, quote, numerous irregularities, including patients not receiving optimized care, the facility in disrepair, leaving an unsanitary environment, and a failure to implement COVID protocols.
Who suffers as a result of this?
The patients suffer.
What you've described and what you've experienced, do you think that honors the memory of Dr. C.W. Williams?
I believe that when they started, this is what they started for. They started because they wanted to be a pillar in the community and they wanted to give back. And they wanted to serve the people that was less fortunate, that doesn't have the jobs, that doesn't have the income, to be able to help them. So I believe that's how it began. But along the way, it has come to the place of corruption and greed. And they should be closed down.
Reporting in Charlotte, Nick Oxner, WBTV, on your side.
The chairman of the C.W. Williams Board of Directors issued a statement in response to our inquiry for this story. It says, in part, quote, most claims are unfounded. However, if legitimate issues are substantiated, we will address them. And it goes on to say, we have enhanced controls in place and brought on a new CFO in 2022 who is experienced in administering fiscal operations of other similar federally qualified health centers and who is well versed in governmental and nonprofit grant budgets and accounting. We've put their full statement online. You can read it right now on WBTV.com.